I think that certification has demonstrated to both myself, my coworkers, and my patients a certain degree of expertise as a pediatric nurse. I feel that having certified pediatric nurse on my name badge has made me a go-to person for issues and questions that have come up on the floor with my fellow nurses, and does help a little bit with encouraging a little bit more respect from the physicians that I work with and my patients as well.
Nurses should definitely seek certification as a validation of our specific skill set. As a pediatric nurse, I am being validated to my peers, to the public, to my patients, my families, to everyone really, as a certified pediatric nurse, as someone who has a specialty skill set. Children are certainly not little people, so having a pediatric certification is awesome.
Children are not small adults, so in order for us to be pediatric care providers, we really need to acknowledge the difference, and having this certification certainly acknowledges our expertise in that area.
The effort that it took to study for the certified pediatric exam and the continuing education credits that are required to continue to be a certified pediatric nurse, I think have made me a better nurse on the floor. It's allowed me to learn some things that I'd either forgotten from nursing school or to refresh my memory a little bit and get a little bit better in-depth knowledge, having to go through the thick book that I went through in preparation for the test.
So as a certified pediatric nurse, using the credential of a certified pediatric nurse with other experience has allowed me to move to the pinnacle of our nursing career ladder, and that has been a very motivating factor.
I think that being certified has given me a certain level of confidence in knowing that what I'm doing is best practice, and knowing that I'm viewed as a person who has gone through has the experience and the expertise to provide the best nursing care for my patients.
I think if you have a friend or a peer, a colleague that you could take the exam with, then that certainly makes it a little bit easier going through the process. But as a pediatric nurse, you'll certainly recognize that you do have some unique skills and qualities and knowledge that will help you be successful in this exam.
As a pediatric nurse, I am specifically a cardiac pediatric nurse, or pediatric cardiac nurse. So my skill set is primarily cardiac in nature, though I'm taking care of children. So studying and being exposed to general pediatric material and other specialty material through the CPN exam and the content outline has been, number one, a refresher, and number two, an exposure to other specialties besides just cardiac. And it has made me a far more well-rounded pediatric nurse.
I would tell a person considering taking the exam to take the exam, especially with the no pass, no pay policy that the certification board has. You really have nothing to lose and so much to gain.
We have the skill set. We take care of these patients every day. Now is the best time. Just get certified, get recognized, be proud that you're a pediatric nurse, and own your skill set.